Hi, my name is Katie, and today we're going to be discussing the endocrine disorder Graves' disease. Graves' disease is an autoimmune disorder that impacts the function of the thyroid gland, leading to excess hormone production. About 1% of people in the United States have Graves' disease, and it is the most common cause of overactive thyroid. Women are 5 times more likely to develop Graves' disease than men. And when Graves' disease is untreated or is not well controlled, some people may experience complications like heart arrhythmia, heart failure, or even a stroke. This can cause a financial burden on the healthcare system and increased morbidity and mortality rates for individuals who have Graves' disease. Graves' disease happens when something triggers your immune system to overproduce an antibody called thyroid stimulating immunoglobulin, or TSI. TSI attaches to healthy thyroid cells, causing your thyroid to overproduce thyroid hormones. There are several triggers, and this can be a viral infection, a bacterial infection, changes in hormone levels in women, or having high iodine levels. Genetics plays a huge role in developing Graves' disease, and in one study, researchers estimated that an individual's genes contribute to 79% of their risk of developing Graves' disease. Environmental factors such as extreme stress can trigger your immune system, and pregnancy is also known to trigger the development of Graves' disease. Graves' disease is caused by thyroid stimulating immunoglobulin, or TSI, which is an antibody that your own body makes that mimics TSH, or thyroid stimulating hormone. The TSI binds to your thyroid stimulating hormone receptor, which is located on your thyroid gland. The binding of the TSI to your receptor stimulates your thyroid gland to produce more of the thyroid hormones T3 and T4. This increase in hormones T3 and T4 causes a negative feedback loop to the hypothalamus and tells it to stop producing TSH and TRH because the body already has enough hormone. Because the antibody is still present, your body will continue to make more hormones and the cycle begins again. This is what causes the hyperthyroidism. The onset of Graves' disease symptoms is typically gradual and can take several weeks or months to develop. But in some cases, it can develop suddenly over just a few days. Graves' disease speeds up your metabolism, and this can make you feel like you are not in control of your body. Some of the symptoms of Graves' disease are anxiety, irritability, warm skin, increased perspiration, moist or sweaty skin, weight loss without a change in diet or exercise routine, an enlargement of the thyroid gland, changes in menstruation, including light periods or stopping periods altogether, erectile dysfunction, decreased libido, frequent bowel movements, loose stools or diarrhea, bulging eyes, chronic fatigue but difficulty sleeping, and also it can affect the skin when the skin on the shins or the tops of the feet becomes thick and red. There's also heart palpitations, shakiness, and tremors. Diagnosis of Graves' disease can be done through blood tests, which check your thyroid hormone levels. There's also a radioactive iodine uptake test, which measures the amount of iodine your thyroid is taking up from your bloodstream to make thyroid hormones. If your thyroid is making up large amounts of iodine, you may have Graves' disease. The thyroid scan is often done with the radioactive uptake test and shows how and where iodine is distributed in your thyroid. In Graves' disease, the iodine shows up throughout the thyroid gland. Another diagnostic tool is the Doppler blood flow measurement. This test uses sound waves to detect increased blood flow in your thyroid due to Graves' disease. The most common treatment for Graves' disease is antithyroid medications. These medications block the thyroid from using iodine to make hormones. They work better when they are taken for longer than a year and when either of the antithyroid drugs are used without other treatments, hyperthyroidism may come back. Beta blockers can be prescribed to help control the effects of hormones on the body. They can ease irregular heartbeats, anxiety, heat intolerance, sweating, diarrhea, and muscle weakness. Another common therapy is radioactive iodine therapy. When you take radioactive iodine by pill, the radioiodine goes into the thyroid cells and over time destroys the cells that make the thyroid hormone. In time, this causes your thyroid gland to shrink and your symptoms ease little by little over several weeks to several months. There is also the option of a thyroidectomy where your thyroid is removed. If you do this, you must be on thyroid medication for the rest of your life. For the treatment of thyroid eye disease, corticosteroids can be prescribed, and an IV medicine called Tepezza can also be prescribed. There are several new treatments for Graves' disease that are in development. B cells play a major role in autoimmunity, antibody production, antigen presentation, and modulation of T cell responses. Rituximab, which is a chemotherapy infusion, is an anti-CD20 monoclonal antibody. It has been used for more than 20 years to treat malignancies like lymphoma. CD20 is found on the surface of B lymphocytes, which include early pre-B cells, mature B cells, and memory B cells. The rituximab causes rapid depletion of circulating B lymphocytes by apoptosis within just a few hours. One study with 13 patients with recurrent Graves' disease received 2 doses of rituximab at 2-week intervals. The study showed that 70% of the patients maintained a normal thyroid function over 18 months. Another treatment being researched is TSH-specific treatment options. Graves' disease is caused by the stimulation of the TSH receptor. Researchers are designing therapeutic strategies to antagonize the TSH signal transduction through small molecules or neutralizing antibodies. By using targeted molecules, they are less likely to negatively affect a patient's immune system. The United States Preventive Services Task Force found fair evidence that the thyroid stimulating hormone test can detect subclinical thyroid disease in people without symptoms. However, there is poor evidence that treatment improves clinical outcomes in adults with screening detected thyroid disease. It is recommended that physicians be aware of subtle signs of thyroid dysfunction, especially in high-risk individuals, such as the elderly, postpartum women, and individuals with Down syndrome. In these cases, it is recommended to use the TSH blood test to detect abnormalities. More emphasis needs to be placed on educating patients about ways they can help prevent Graves' disease. Simple things such as reducing stress levels, eating a nutritious diet, and avoiding food rich in iodine, gluten, soy, and caffeine can help. Lifestyle changes such as regular exercise and quitting smoking are also very beneficial. Patients who are at a higher risk for hyperthyroidism need to be informed of the signs and symptoms of Graves' disease so they can be aware. Equally important is educating patients on the importance of treating Graves' disease to prevent significant complications such as heart failure and stroke.